President William Ruto used the Mashujaa Day celebrations to mount a strong defense for his healthcare plan under UHC. Well, this appearing to be in response to the concerns raised by Kenyans over the additional tax measures. The president directly took on the critics of his raft of taxes that continue to eat away at the paycheck, making a vow to safeguard their monies, even as he warned those plotting to dip their hands in the cookie jar that the law will be on their trail. Chamutai Goin reports.
With disquiet over what seems to be the fifth administration's insatiable appetite to impose additional tax measures on Kenyans getting louder by the day, President William Ruto took on the critics of his actions as he defended his healthcare plan, which imposed additional taxation on salaried Kenyans.
Nitahakikisha ya kwamba pesa zenu munazolipa kwa ushuru, kwa jasho lenu, pesa zenu ambazo tunakusanya katika kaunti zetu kwa levies, kwa taxes na kwa njia zingine zote, pesa zenu zitatumika kwa njia inayofaa, haitafujwa, haitaibiwa, wafisadi hawatanyemelea, na tayari nimetangaza katika taifa letu la Kenya.
The president addressing the elephant in the room, the Social Health Insurance Act 2023, which establishes a social health authority which will be funded by taxpayers. Kenyans concerned that the money would be misused.
Na mtaona mambo hivi karibuni ya kwamba wale wote wanahusika na kuiba pesa ya Wakenya na mambo ya ufisadi na mambo ya ukora, mambo yao ni matatu, na nyinyi mnajua vile nimesema.
Defending the creation of the Social Health Authority, which will replace NHIF, the president admitted that NHIF had run its course and had unfortunately been exposed to fraud and mismanagement.
The NHIF operates as a passive rather than a strategic purchaser of healthcare. It is plagued by inefficiency and governance challenges and is potentially, unless addressed, financially unsustainable.
The president further built a case for the Facilities Improvement Law, which will facilitate the retention, management and use of revenue derived from health-related services rendered at public health facilities by the respective facilities.
Kila hospitali, kila dispensary, kila health center watakuwa na pesa zao, na pesa ya facility yenu haitapelekwa katika facility ingine na haitapelekwa kufanya kazi ingine yoyote. Itatumika katika hiyo facility yenu.
We were able to launch the ICU at Kapkatet, which was equipped by your government. We were also able to launch our basic oncology center in Kericho to handle matters cancer through the support again from your government. And we want to say thank you for this.
In his speech, the president confirmed to Kenyans their worst possible fears that the payslip would thin further in coming months after regulations affecting the Social Health Authority are approved by the August House. This, he says, will level the playing field for Kenyans.
Previously, an individual earning 10,000 had to pay Kenya shillings 500 for NHIF, a hefty 5% of their earnings. Astonishingly, even someone with monthly income of Kenya shillings 1 million, like William Ruto, the president, paid the same amount of 1,700, which translates to a paltry 0.17% of their substantial earnings. This bizarre setup meant that low-income earners, mama mbogas and bodabodas, were effectively subsidizing high-income earners like myself.
The launch marking a paradigm shift in the healthcare sector, where emphasis would be laid on promotive and preventive care rather than curative care. Despite questions that have been raised regarding the financial implications of the 4 laws that were assented to by President William Ruto that are set to make UHC a reality, the president urged Kenyans to look at the brighter side of things and how the laws would break down barriers and bottlenecks to access to proper health care. Chemutai Goin, Citizen TV at the Kericho Green Stadium, Kericho County.